Welcome to Sit With Me. I am your host, Tori Christina, and we are here today to continue to talk about mental health, which I have learned from my guest is now called behavioral health. And we will talk about exactly why people don't want to say mental health because it's truly mental. But I can understand that it affects your behaviors. So maybe that's what the relation is. But I myself, as you know, guys, I am Tori Christina, and I was diagnosed with PMDD about the age of 20. I was in college and found out that I have premenstrual dysphoric disorder, which tends to make me a little bit different for about 2 weeks. And I've learned over a period of time of how to handle it, how to manage it, what makes it worse, and what makes it better. So my plight here is just to help people understand that you can get a hold of your mental state and you can do something about it. Even in the worst states, there is something that you could do. I think we have a responsibility to manage the things that God has plagued us with. It's just sometimes it's just a part of your makeup. I understand that some things come from trauma because I know like when I go through different traumatic situations, it gets worse. And I have to be more intentional about what I do to manage it. So today, guys, I kept a card out because this is very important about our guest today. This is Dr. Monique Brown. She is, now I'm going to say, let me say all of these letters. I do not know I know what a PhD is. LMHC. What is that?
Licensed mental health counselor.
Okay. MCAP.
A master's certified addiction professional.
Okay. SAP is CAD. That's all a part of it too?
No.
Okay. SAP.
A substance abuse professional.
Okay. CA. Did I say D now? CAD.
Certified addictionologist.
Whew. And she is the CEO. After all that, she is the CEO of Integrated Healthcare Systems, primary and behavioral health care. Welcome.
Thank you.
It's so exciting. Like you did a lot of work to get all these letters.
Yes, I did.
Okay, well, how long did it take you to achieve all of that?
9 years.
Really? That's not bad.
No.
That's a lot for 9 years.
Yes.
So is that 9 years consistently?
Yes, consistently.
Okay.
And I started late, believe it or not.
Really? Oh, that's awesome. So that's encouraging. I'm not going back to school. I tried to go back for my master's and I was in there like the first 2 classes I was good. That third class, I was like, I can't pay attention. It's probably with the issue. You know what I mean? I might have started that week because I actually shared with Beethoven. I said, I think it has the PMDD. It really looks a lot like, to me, when I studied it and the symptoms, it looks a lot like borderline personality disorder, right? But I swear it's like ADHD too, because I cannot pay attention. It's so hard to focus during that time. It's terrible. So anyway, so tell me about your business and what you do.
Well, Integrated Healthcare Systems, we provide primary care and behavioral health services all under one roof. So I actually started in 2004 providing services for homeless veterans. So what actually got me started
was that was the beginning of your...
Yes, actually I started what got me actually started was my brother. My brother was a veteran that served his country, and he passed away in 1994 from HIV/AIDS, and he actually had addiction to alcohol and some drugs. And I just watched my brother actually just suffered and trying to find community services at the time. And it just bothered me to, try to find resources and services for my brother. And at the time, he was slightly homeless. And to, watch my brother, serve his country and not be able to find any services or have any services for him in place, it was disheartening. So one of my missions were, I wouldn't allow another veteran to actually have to suffer, and not have any services in place. And that's what actually got me started. And so 2004 is when I started providing housing services for veterans.
So what were you doing before that?
Well, before that, I actually had a paralegal services, providing just assisting people.
So you basically have always been an entrepreneur, but you
Yes.
weren't necessarily in the field of health.
No.
Okay. All right.
No. And just over time, it just materialized. I think I've always had the heart to assist and help people.
Mm-hmm.
And it really wasn't until I actually got into the field of providing the housing
Mm-hmm.
is when I actually, opened my eyes. It wasn't even during the time, when we were trying to find services for my brother. It was just, helping my brother, trying to find the services and trying to find housing. It wasn't an eye-opener then. It wasn't until I started actually providing housing for other veterans and trying to understand their addiction and understanding their mental health at the time. At the time, it was mental illness and, alcoholism, or at the time it was crack cocaine. And so I didn't understand any of that. I was just clueless. And I'm trying to help them, and I didn't even know what I was dealing with.
Right.
And I'm trying to refer them to different services. And again, I'm running into roadblocks. And then in 2010, I opened a larger house. And then it just dawned on me. I said, you know what? Let me go back and try to get educated. Let me try to get educated to see
To understand
how I could properly assist these individuals. I'm just providing housing. I'm doing a disservice to them. I'm housing and I don't even know what I'm doing. I'm providing a roof for them, and I don't even, I'm not even fully assisting them, on a day-to-day basis. And that's how my education started, by truly, going back to school and trying to understand what I was actually dealing with.
So when you had them, you were housing them, but you were able to notice that there is something else wrong here.
Yes.
Yes. And I wrote one down of my questions I wrote down for you, because you brought it up about the addictions. So now you've been in business for 9 years now, right?
No, I've been in business since 2004.
Since 2004. Okay. So that's 7 years.
That's actually 7.
I'm sorry. My math is really bad. So I was a
18
teacher,
years.
right? It is so funny because when I took my certification test, I passed math and science first. I don't even know how. Like, how I passed math and science, that's what I actually got certified in, but I don't know how, because I cannot do math on top of my head. So how many years is that? 18. 18, yes. You know what I was trying to do? Because I have a son, but he was born in 2014. He's 7. But my 18-year-old was born in 2004. So I should have known that. Anyway, so over this period of time, do you see the connection between like addiction and mental health or behavioral health?
Significantly.
I know, right?
So that is why I say it's behavioral, because I found over the years, even primary, that's how we got into the primary part, because it all ties together. It all is significantly entwined with one another. From the substance abuse to the mental health, from the mental health to the substance abuse to the chronic health, it all ties into one another.
Right, because like I said, with me, it sometimes it's better than others. Like if I go through something traumatic, then I'll go back to my doctor and make sure I get the right prescription to whenever, and use it until I'm able to wean myself off of it and, operate and function by myself. But I do notice that during that time period, like I'll want to drink.
You just want the pain to stop at that very point of moment.
It's like you're trying to do something to numb that thing. And you can't always put your finger on what it is, because when I'm outside of that window, I'm perfectly fine. I don't need nothing. I'm A-okay. But inside that window, and especially when it gets closer and closer, that's why I'm like, I just need a drink.
Or a trigger. It could be anything that triggers it. Yes.
Yeah, I also thought about, so one of the things with my show is that I wanted to create a platform that people could understand more about it so that we'll be more accepting of people that struggle with it. And for it to be connected to addictions, I think that's just like, I don't know, it's kind of like a hard place because somebody literally, you think that they're just an alcoholic or a drug addict, but they really are dealing with some mental issues.
Which at our behavioral health facility, because we have a behavioral health facility, and one thing we try to get the family to understand, whenever we provide services, especially counseling,
Mhm.
or even group, we try to get the family involved.
Okay.
Because one of the things that we try to explain to the family, although yes, you want us to fix your family member, we also have to fix the dynamics of the family,
Right.
because it actually starts with the family. Because if you don't understand why this person is at the point where they're at, then I can't fix them, because it starts with the entire family.
Mm.
And oftentimes family don't want to see that, because they always think it's the person, and that's not the
Yes.
truth.
Yes.
It starts with the whole family dynamics. It's like with my brother. Like, I have a sister that is schizoaffective, and thinking back, with our family dynamics, how we actually grew up, it started with my mother. It really did. At the time, growing up, we didn't see that, in
Right.
our mind, it was like, oh my God, she's crazy. Like, we're not going to deal with her.
Right.
Like, but when you really sit back and you think about it, and you think about, how we was raised and everything that we actually went through, then that the dynamic started with actually my mother, how we was raised, and the different things that she instilled in us, and the different things that we actually went through.
Mm.
The dynamics literally started with our mother. So, it's even like when we do certain groups and we're talking, I often tell, like when we do women groups, you got to be careful how, certain things that you instill with your kids, because that stuff travels. And if you don't be careful, your children will pick up certain things that you actually do.
Mm-hmm.
And you got to be careful how you mark your kids. You really do, because it can scar them.
Yeah, I think I saw somewhere where they were talking to children of people that have help me again, behavioral health issues. Is that what we saying?
Or mental health.
Okay.
I don't know.
Okay. So when they have mental health issues, and the children, like growing up in a household with somebody like that, and the person they have not, classified that that's the issue, it's like really traumatizing.
Yeah, it is. It's like, I often say there's no such thing as a bad child. It's not. If you look at a family dynamic, like if it's like a child that really acts out. So if
Right.
you look at a child that acts out, I promise you, if you go to the house,
Right.
and they always say, no, that's a perfect family. No. I bet you if you
Something
dig
is
to the
going on.
deepest part of that surface,
Yes.
you're going to see that there's some deep things underneath the surface of the household that hasn't came out or needs to come out. And you'll see why oftentimes children act out. Children don't just act out. They don't.
Right.
There's things that need to be addressed that's oftentimes that's not addressed.
Right.
Or it's things oftentimes children can't address themselves, or sometimes they do have behavioral health issues that need to be addressed, but we don't, especially in our community, we don't get the help for our kids because we say they're just bad, but they're usually not bad. We just need to try to get our children help and assistance.
Right.
And stop always putting the kids on medications, because that's not always the answer.
Right.
Sometimes you need to put your kids in front of other people to try to help them, express themselves, and not always have somebody write a script for your kids, because that's not always the answer.
That's good. I one of the things that I'm creating right now is called Something Different, and they're like activities and events for families, but also like things that people, like you say, and putting your kids in different atmospheres. I know when I was teaching, it was important to me to expose my students to different things, and I taught at a Title I school, so they didn't get a lot of exposure. But I noticed like they're brilliant children, but they're living in very hard situations. So I tried to bring that experience to them. I really forgot where I was going with that. What did you say before that? What did you say?
Sometimes you got to
bring them in front of different people. Yeah. Okay. And so, the event, something different. Yes. Here we go. I'm back. Something different is just, and I really originally made it for children, just different things for kids to do, like come together, chess clubs, but like really on a high level where, especially like you say, in our community, that they get those experiences, but then they don't have to feel like they're different because they're different. Mm-hmm. I don't know if that makes sense. Yeah. Okay. So yeah, just creating atmospheres where people are accepted. I think that is just so important to me, because if somebody's trying to heal from something or get better and they feel like an outsider, or like I said, if you know you already I know I'm different. So, but if I'm in an environment where I'm being picked at for being different, I'm being ridiculed for being different, I'm being blamed for being different, and there's nothing I could do about it, it's just not a good place.
Well, a lot of times we have to educate the entire family. That's what I was saying earlier, that you have to educate the entire family. So it's important that we try to get as much education in our community and with the whole entire family dynamics on what mental health or behavioral health really looks like. Mm-hmm. And our community have to stop closing their eyes to it. It's not taboo. It's not taboo. It's not
right, because so many people.
It's you just need to open your eyes, and you have to be educated. Just take the time to just be educated on what mental health really is. It's not going to go away. It's really not.
At your facility now, you say you do primary care and
mental health. And we do mental health and substance abuse counseling.
And who is able to access those services?
Anyone in the community. Anyone in the community is able to access our services.
And you take insurance?
We take insurance, and we even have sliding scale fee if you do not have insurance.
Wow. And so anyone that is dealing with behavioral health, mental health, substance abuse, even primary care can come to your facility.
Yes, ma'am.
Wow, that's awesome.
And we see ages 12 to 99.
Do you really see older people, even when we're talking about the mental health side? Do you see?
Yeah, we don't see that many. I think the oldest person we actually have is 67, I believe. 67. Mm-hmm.
Do you have people like finding out that they have this issue later in life that never dealt with it earlier?
It's always been there.
Really?
Yeah, it's always been there. Now, did they address it at an early age or sporadically? Yeah. Mm-hmm. But it's probably always been there.
Yeah. Mm-hmm. Yeah, because I found myself, like I said, I'll be on and off or whatever, but I had to go through a place of accepting that this is a part of me that I have to be accountable for.
Now, we see a lot of that. Not wanting to accept it and just get lost in the system or get lost in the system. We see a lot of that.
So why do you think people do that?
Not being appropriately educated.
Okay.
That's the biggest thing. Not being appropriately educated on what your diagnosis is. Not, a lot of times if your diagnosis is just, hey, you're bipolar. Take this med and, you're sent out the door. Not really being truly educated on what a bipolar diagnosis is, what you can do. Mm-hmm. The diagnosis is never going to go away, but hey, you can live a healthy life. Your life is not going to stop. Mm-hmm. But this is a therapy for it. Mm-hmm. And I think if you're explained, if you're educated to that, if you're educated on what your diagnosis are, then you can accept it a little bit better. That's one thing that I push my staff, all of my providers in my facility on, is educating the patient
Mm-hmm.
from primary to, behavioral health. Don't just give a client or a patient a diagnosis and send them out the door. Educate the patient, explain to them, take time. Yes, I know we might have a slew of patients and you got to try to get this patient in and out the door, but take the time to at least, hear the patient out and allow them to ask questions. So I'm really big on educating. I'm really big on that because I know during the time my mother was actually passing, and that's really one of the main reasons why I push for the integrated health, because I know when my mother was passing away, and the doctor was telling my mother that she had these different things going on with her,
Mm-hmm.
and was telling her like Picola, you need to go here, and you need to go there, you need to go here, you need to go there, and not really explaining to her why she needed to go to different specialists. She refused, and I just believe
she
that
didn't
if
know
he
why.
would explain to her why she needed to go to these different specialists, she would have probably went, even though she was stubborn, but she probably would have went a little sooner than she did, and it probably would have saved her life, but she didn't. And I, I just believe now I can save someone else, because I feel like I couldn't save my mom, so I feel as though I can save somebody else. So having all the services in one building, I can save somebody else through my mother.
That's awesome. So for you personally in your life, what did you see come out of that? How did it affect you mentally?
So my mother was a young teenage mother. And she, how can I say? She had a lot of trauma.
Mm-hmm.
And growing up, I didn't realize just how much trauma my mother actually was subjected to until she died.
Mm.
My mother had a lot of trauma.
Why do you say until she died?
She also experienced, how can I say? She also experienced, separation anxiety.
Okay.
It was herself and four of the siblings, and she was raised by her mother,
Mm-hmm.
and then her four siblings was raised by their fathers. My mother always felt alone,
Mm-hmm.
even having her children as early as she did. She still always felt alone. So she always, even having us, she just felt like she didn't have anybody in the world. And it's like she just played us against one another. And it's like even having us, it's like she didn't have anybody. So it's like we didn't even exist, honestly. And it's sad to say that, but we really didn't exist. And so as much as she said that she loved us, and as much as we tried to show her that we loved her, it never seemed like it was ever good enough. Mm-hmm. And so, and when I said that, I didn't realize how much trauma she actually went through until she died. It's like it was an eye opener. You just knew that was your mother, and you just, at the end of the day, you had to respect her, because that's what the Bible said. You need to honor your mother and your father.
Right.
So I think I just did it because that was just respect, and I needed to do it because that's what I just had to do, respect my mother. But it's crazy to say, it's like I felt like I was always in a cage, while my mother was alive. And then it's like when my mother had passed, it's like
you were free.
I felt free.
Wow.
I just did. It's just that, she died at my house, and it's like the day she died, I felt like I was free.
Wow.
I did. And it's sad. I think the rest of my siblings probably felt the same way.
Mm-hmm.
I think they harbored a lot of animosity because they just didn't understand a lot of the decisions that my mother actually made over her life. But as I explained to them, when somebody went through so much different trauma that my mother went through, as a child, and she didn't understand the trauma that she went through, all she did was just spill that trauma over to her kids. Mm-hmm. And so she couldn't explain it. And because she couldn't explain it, you just got what she couldn't explain.
Right.
And so, you blamed her for something that she couldn't explain to you, and she didn't understand
herself.
So all you could do is just forgive her, mm-hmm. and just try to understand. She did the best that she knew how
possibly
to do.
Could. Yeah, I always say that, like, people, you want to hold people accountable for their actions, but if they really, in the state that they were in, did the best that they could do, that's the best that they could do.
Exactly.
It might seem like the worst to you, but it's really, they're doing their best.
And honestly, I think, God put me into this field because I think if I wasn't put into this field, because believe it or not, I opened this facility March 1st, 2015, right? My mother was diagnosed with cancer March 27, 2015. My mother passed away December 31st, 2015.
Wow.
So I was just getting into this, into the field, the facility, and really truly learning my craft and, understanding, about the really mental health and the substance abuse and so forth, really truly honing in on it and understanding it. So if I wasn't in this field, I don't think I could have said that. I don't think I could have accepted my mother for who she was, mm-hmm. and everything that she had taken myself and my siblings through. I don't think I could have accepted any of that.
Because you see it.
Exactly. So it was like dealing with clients, understanding what clients had been through, listening to
and you
client
hear the same story.
Exactly. Listening to client stories and, just holding clients and trying to explain to clients, like, listen, parents are parents. Parents make mistakes. We don't get manuals of how to raise you or, how to be a parent. We just do what we can do. We do the very best that we can do as a parent.
Right.
And so, yes.
And then you're saying, like, you being free once she left. So that makes me know that when a person with mental health issues is, like, the people connected to them live within that box as well. Like, that's why I began to take more responsibility for mine, because I saw it affecting other people. And I was like, I have the ability. Mine's is just within a window. I can imagine if it was, 24 hours year round and I was dealing with this thing, it would be even more difficult. And so that's why I wanted this platform, because I'm able to articulate how I feel within this window. And then I get an opportunity to be what I call normal. I get to be normal, but really and truly, like, if I lived in that space all the time, it affects the people around you. And
yes,
so they become a prisoner to your illness. When you don't,
especially if they don't understand.
Right.
And so it's really like, and it goes back to what I said, it's very important for family to really, really be educated and understand. And when they're not educated, they will never understand. And and unfortunately, like I said, my sister is schizoaffective, so we deal with that right now. And she has 5 children, and her kids go through that. So her children don't understand. So her children unfortunately don't deal with her. And, my sister is living in the world pretty much by herself. So she, her kids don't have anything to do with her, because they don't take the time to kind of understand.
Just understand it.
Trying to explain to them, they think their mother is normal and understand what she's doing, and to try to explain to them.
They're like, why?
No,
your
mother doesn't. And this is, the highs and the lows of your mom, and, she doesn't take her medicine. This is what happens. And, we just have to try to, help her the best that she can. And so, it could be very challenging.
That's sad.
It really is.
It is. It's really sad. I have a high school friend. He's bipolar, and get to chat with him sometimes on Facebook, and he says the same thing. He's like, I feel very lonely because people don't understand, and they really think that I'm just a funny guy, but I'm not being funny. I'm being myself. And he says he feels stupid a lot of the times, like other people make him feel dumb because they, treat him like a clown. But he's like, he really, that's just who he is. But he recently, I seen him post that he stopped drinking. And so he's been sober since January, and he feels very good about it. And so the comment that he made on Facebook is that so he'd rather be bored than be drunk. So he's gotten to a place where he's able to make conscious choices.
Very good.
Yes. And I was like, that's really awesome. And that's what it really takes when you're able to, I guess, clarify your mind good enough to be able to see, okay, I have a decision that I have to make.
Exactly.
I can't just allow this thing to overtake me. I have to make a decision as to what kind of outcomes I want.
Exactly.
Yeah. Wow. So so your sister is she in a home?
No. Unfortunately, my sister is homeless.
She's homeless right now. So does she come by your facility?
No. Every now and then I'm able to find her, and every now and then I'll let her stay with me for a couple of days. Well, she will only stay a couple of days, and that's by her choice.
Right. Yeah. I especially with that. So a lot of times people that deal with that, they don't want their family to see them like that.
No, her paranoia is so bad, so you have to give her space. So you cannot crowd her like that.
Yeah.
So you have to just respect her wishes. So, and I do. So when she tells me that she's ready to go, I have to, as much as it hurt me, I have to respect her, and I have to
just let her go.
Let her go.
Yeah. So do you get to talk to her about how her experience is out there?
No, you can't do it.
Can't do it?
No.
Wow.
So I just pick her up. I take her to eat. I let her shower. I let her spend the night. And when she tells me she's ready to go, I have to take her back.
Wow. That's big. So how many brothers and sisters do you have?
It's 5 of us.
Okay. And so how are the other ones?
Everyone is good.
Everyone's good. That's awesome. I'm glad to hear that.
Everyone's good. I think each one of us have our own different mental health, honestly. So, yeah. Each one of us have our own diagnosis. Honestly, we do.
So what's yours?
Oh, I'm no doubt probably bipolar.
Really? She said no doubt probably. Wait.
Oh, yes.
PhD, LMHC.
No doubt.
Yeah, I've one of my guests was on the show. She's a behavioral health care counselor, and she's bipolar. But she handles it very well. Like, she just does what it needs to do.
Trust me, anyone that is in the profession of counseling, don't let them fool you.
It's
a therapist always has a therapist.
You know what? We had a therapist, and I'm telling you, the guy was so good, and now he's missing. So I said, I knew he was too good. So he done went off the therapy. He don't even answer emails, phone calls, nothing. I'm so upset because he was like one of the ones I really enjoyed, like, our sessions. And now I can't find him. He gone off grid. Like, I hope he come back. So what are your what do you say to families that are they're noticing that there's some different behaviors in people that are in their homes or around them? What is your suggestion? And if they're with somebody that's bipolar and they are not gonna go to the doctor, what do you do?
I always say at least call a professional and at least ask questions. Don't guess or assume. At least call a professional and just ask questions. Allow us to just give you some of the diagnoses or symptoms. If it's really severe, then you need to, call and probably have them evaluated, have someone come out and have them evaluated to the point if they need to be probably professionally Baker acted.
Okay. So the Baker Act is how you get them
Involuntarily committed.
Oh, okay. And those that happens when, like, if they're harming themselves or
if they're a threat to themselves or others in the home.
Okay, then you can get them Baker acted. Does that stand for substance abuse as well?
Well, no, because the substance abuse is a Marshman Act.
Oh, okay. But there is a way to get them help.
Yes.
Without their consent.
Mm-hmm.
Okay. That's good to know because I didn't know that. Okay. So y'all listening.
I like you guys afterwards.
Right. I think a lot of people have watched Intervention. We know how it goes. But there is a way to get your family members help. So that is a Marchman Act. It's called a Marchman Act for substance abuse. And what is it for?
Baker Act. Involuntarily commitment.
Okay. For Baker Act if it's behavior or mental health issues. So,
it's just a temporary hold that you can call the police if you feel as though they're a threat to themselves or the police. And they will come out and they will take them to either St. Mary's, which is IMH, or JFK North. But the key is that when they're released, you have to push them for follow-up care. Now, a lot of times, most family members won't go for the aftercare follow-up. So
the family has to go for the aftercare?
Well, the person that is involuntarily committed, they usually don't go to the follow-up care, and that's usually where the problem is. They won't follow through. That's what the problem is. They don't want to go.
Yeah, and these are grown people, so then if they've been living this lifestyle for so long.
And usually it's embarrassment. And that's the thing. So a lot of times people don't want to be seen coming into a therapist's office, but what people fail to realize, this is the new age. You can do everything right online. So you can receive treatment right online in the privacy of your own home with your little smartphones. You're always on Facebook anyway, so you might as well use your smartphone.
And nobody has to know.
And no one has to know at all. You just pick up your phone and just chime right in.
Get you some help.
Exactly. Just get you some help.
Get you some help. Y'all listen in. If you are feeling, I'm going to say some kind of way, and you know something is off. It's just that inner knowing that something is not right, something is unstable. Get help. Get help. And like Dr. I'm going to call you, can I call you Dr. Mo? Oh, because I was going to call you Dr. D. Okay, because Dr. Mo said that you can get help right in the privacy of your own home. So there's nothing to be embarrassed about. I think the more embarrassing thing is to let it overtake you, because once that sickness overtakes you, like you said, it's hard to come back from that.
Exactly.
So,
and sometimes we have to, I think the biggest problem is that we oftentimes go to friends and we go to relatives, and sometimes it causes more harm than good. And sometimes you need to let a professional help. Okay. Right. Sometimes you have to know when it's okay to talk to your friend JoJo and it's okay to talk to grandma, but sometimes you have to go to a professional, and that is why God put professionals here, right, like doctors and therapists. That's why he, put these professionals here on earth to help you. So you got to know when to use your good senses and utilize professionals.
Okay. So as we're closing out, give us what are your main things that you like to speak out to people when it comes to mental health? What are you want someone to take away from this session? What would you say to them?
Mental health is just like high blood pressure and diabetes. It's a disease. You have to treat it. just like a disease. If you don't, it will kill you.
Wow.
And if you love your life, you would treat it.
That's strong. It's just like if you do not take care of it,
It will kill you.
you. It will.
It's the truth. It will.
Wow. Because even if you don't, if it doesn't kill you automatically, physically,
It's going to kill you mentally and emotionally.
Yeah. Oh gosh. So that now I'm like, why do I get so sad? Like, because it's sad. It's really it's really amazing, especially when you put it in those words that it could kill you.
It really can.
So that's something that we don't want to, I don't know, downplay. Because I said it before on here is that we'll say, oh, they just crazy and, that fun friend in a group, but they really dealing with something, like it could kill them. So
The last thing, stop suffering in silence when you don't have to.
right.
Stop. Just reach out for help. No one has to know, and just get it out. Sometime just talking to somebody and getting it out, sometimes that can just help. And understand therapy is not to fix you. It's just sometimes you just need to be able to get it out and just let somebody guide you with a different perspective. That's what a therapist is for.
Yeah.
It's just to sit there and just listen and just give you a different perspective.
Yep. And especially if you're dealing with mental health issues, you need a different perspective.
Exactly.
You need to see it a different way. And somebody else can just show you a different way.
Exactly.
Wow. Well, I thank you,
You're so welcome.
Dr. Mo, for being on our show today. Shout out your facility. Do you have a phone number that
Integrated Healthcare Facility. We're located at 31 West 20th Street in Riviera Beach. The telephone number is 561-510-0471. We're open Monday through Friday from 8 a.m. to 5 p.m. And we're open to 7 p.m. on Thursday.
Wow. Good stuff. You guys, you have no excuse. If you're listening to us with Sit With Me and you're hearing all this valuable information, you do not have to suffer silently. Get some help. Help. Because help is there. I thank you all for listening in. Tune in on our next episode of Sit With Me. Thank you.